Hi, I'm Jen DeYoung, United States of Care's Director of Policy leading up our Building Blocks of Health Reform initiative. Thanks for checking out United States of Care's video on equity in virtual care. In 2020, we've seen the COVID-19 pandemic response unleash a revolutionary expansion in virtual care, whether it be telehealth, remote monitoring, or other remote forms of communication. Virtual care tools are shiny and new for many, but at United States of Care, we're looking beyond the present to the potential it has for being a long-term lasting solution to close gaps, address barriers, and get more people access to the care they need. To do that, we're starting with people and taking time to listen to their experiences with virtual care. What's working, what's not. For example, we fielded a national poll in November 2020, and we know from that there's wide support for the convenience of virtual care, especially during the pandemic. However, many people have questions about the accuracy of care and concerns about the use of technology. We're continuing to listen to people and pairing what we hear along with what the research evidence and experts know so we can see what's needed as virtual care policies are formalized and practices are refined to ensure we create a virtual care system that works for everyone. I'm excited to share with you today perspectives on virtual care from some of the healthcare leaders who are partners in guiding our work. In this conversation, you'll hear from
Good morning, everyone. My name is Sonakshi Dixit, and I am a pre-med student at Vanderbilt University interested in public health. I'm very passionate about telehealth and affordability in healthcare.
Everybody, my name is Nell Buhlman. I am President and Chief Operating Officer at Press Ganey Associates. And the mission of our organization is to reduce patient suffering. And we do this by improving the experience of patients as well as the people who take care of them. We do lots and lots of measurement around the different facets of the patient experience and the caregiver experience and offer insights and analysis to our clients so that they can understand where the gaps are and determine how to address them.
Everybody, my name is Anita Pramoda. I'm at Owned Outcomes, and we do lots of measurements solely focused on the outcome side of it. The goal is for care to be wonderful and financially sustainable.
Thanks to Anita, Nell, and Sona for sharing their voice. Enjoy.
So I have two different guests with me today, each from different walks of life with several intersections in their careers. We have Nell Buhlman, the president of Press Ganey. She is a national leader in patient experience, workforce engagement, and clinical safety. And also Anita Pramoda, who is the CEO of Owned Outcomes and an analytics leader in value-based care. We gather in a moment of time that places us squarely in a pandemic that has exposed inequality in just about every direction that I look and has made people across the board feel vulnerable. Everyone from patients to healthcare workers, families to students. People need help, and telehealth is what is helping. The question is, what is it doing? Where does it fall short? And what is the future of it? Let's visit with our guests. So ladies, what does telehealth mean to you?
I think I'm happy to take a stab at what telehealth means. I don't know about to me individually, but thinking about just sort of a broad definition of telehealth, it is a modality where a patient is receiving care not in person, not in clinic, not in an office. So you really could have a couple of different iterations there. You could be receiving care telephonically. It could be delivered through a virtual visit. It could be synchronous. It could be asynchronous. So there are a variety of ways to think about the modality or the multiple modalities in there, but the principal defining factor is that you're not in person.
So for me, I think about telehealth as a consumer. My life today is tethered to a cell phone, right? There's almost no difference between my own identity and my connected device. And if by way of that device, I can access medical help when I want it, can get in touch with someone competent and compassionate, can do that with privacy, and without that device or that modality being burdensome. And if I could almost feel like that modality doesn't even exist, and somehow I'm seamlessly connected to the source of medical help, and if I can get the help I want at the time I want it, to me, that's good telehealth.
Great, thank you. So there are barriers, of course, that certain populations might have to face as telehealth becomes more popular. Older populations, for example, might have trouble with trying to learn the technology or even getting connected with the doctor in the first place. Also, homeless, low income, rural populations might have trouble getting connected as well. So going forward, what are your suggestions or recommendations on how we remove these barriers?
Well, as I think about those barriers, and they're very important barriers, I mean, maybe we pause first and sort of contemplate the rapid explosion of telehealth over these last few months. It's interesting to me because as a company that focuses on measurement in healthcare and really tied directly to the patient experience, the caregiver experience, the safety, the quality, we're constantly measuring on all of these domains. We developed instruments for virtual visits and telemedicine, I'm going to say it was about 3 years ago, and they were really poorly adopted. It just was not very prevalent. Telehealth and virtual visits were not very widespread. Isolated pockets where we saw it. And there are a million reasons that that's the case. It's not traditionally how people received care. There was trepidation about moving in that direction. There were payment policy issues. So just to give you a sense for sort of the degree of explosion in telehealth, in all of 2019, we administered 720,000 telehealth surveys in all of 2019 for Press Ganey for our clients. And during the first month, the first month of what I think of as the first month of the pandemic, but really it was just our first month of dealing with it here in the US. In 2020, we had administered 2.4 million surveys from January through April. Now from January through October 31st, 2020, we had administered 18 million telehealth surveys. Now that sounds like a lot, and it is a lot. It's actually a drop in the bucket for us. We do about 450 million surveys every single year. But that is an enormous growth in such a short period of time. So far, 3 quarters in 2020, we've already done 2.5 times the number of virtual visit surveys that we did in all of 2019. So really, really a huge explosion. The measurement piece is really important because for us to think about disparities, equity, the different experiences of different members of the population, you have to measure. You have to understand not only the things that make telehealth successful for those receiving it and those delivering it, but also how those needs might vary according to the attribute of the recipient and really, frankly, the attribute of the individual delivering the care as well. So this notion of measurement and being able to segment, that becomes very important for ensuring that it's a positive experience all around.
You know, let me piggyback on what Nell said. So I want to discuss MA populations. So, MA is Medicare Advantage. So these are elderly, frail seniors that are very, very sick. And so one of the first barriers is when you go in and you have to understand their health circumstance and record it accurately. You do that to compute what's called a RAF score. And traditionally you had to do it in person. And that's the only way what your findings will be eligible for that computation. And that's a driver of reimbursement. And then when this pandemic happened, everybody agreed that, okay, you know what, that's not reasonable and not feasible. So we will allow this to be done on video. Except most seniors don't have a connected video device. So one of our customers, which is a regional health plan, had to ship video devices to their patients. Except it's not intuitively obvious to a senior who in their lifetime saw television show up for the first time. There's a lot of change in society that's happened in very quick succession in their life. Right? So then they also not only did they have to ship connected devices, they also needed to enable these devices to be push button. And then in addition to that, then there was a bunch of patients who had to access a call center to receive help on how to turn on the device and how to fire up that app to get connected. And then there was yet another tranche of seniors who needed the help of medics or home health workers to visit with them to help them enable that telehealth visit, just to launch that application, right? So I think that's my way of saying the barriers are not trivial in terms of people being able to access telehealth. And then the second story that comes to mind, and this is from another payer customer of ours, we saw on a year-on-year basis in Q2, the single highest condition or primary diagnosis that was treated virtually this year compared to last year was mental health conditions and substance abuse disorders. And the year-over-year growth in that is 5,000%, right? And it's 5,000%, and that's very shocking, but I would say it's also a blessing because this modality is making it perhaps a little bit easier to enable access possibly destigmatize this particular issue, and is enabling people to get the help that they need to get. But it's also, it's also in our face how prevalent those issues are, and makes me very concerned how long the tail will be.
Thank you both for your insight. What primarily started out as an effort to stop the spread of the coronavirus, telehealth has also helped many families get access to healthcare without the cost of driving long distances in the case of rural communities, or even childcare costs. So how effective has telehealth been, and what is the general consensus about telehealth with doctors and patients? Do they like it? And do you think that the benefits of telehealth are enough to make it stick?
Well, I would say from our measurement, what we've seen in the early days of this explosion in telehealth and how we're seeing changes in patients' experience over time has been pretty interesting. First off, there was just a great sense of relief among patients that they could still have access to their physicians. And we saw that. If we think about how we're asking questions about the patient experience, we're asking around sort of categories generally of people, process, and we introduce technology in our virtual visit and telemedicine surveys, because technology is a really big component, obviously, of that modality of care. And what we saw generally was there was great appreciation for the people, in terms of empathy, communication, being very mindful of patients' worries and concerns, really trying to understand symptoms, explain medications, explain next steps, et cetera. So off the charts in terms of how patients felt about that piece of it. And then when we come to the process, setting up the virtual visit, accessing a virtual experience, you saw some real differences depending on the age of the patient, frankly. So the younger the patient, the more comfortable with the technology. The older the patient, the less comfortable with the technology. And so that was really an area where there was a lot of opportunity. As we have progressed here now over several months, we are seeing that the expectations of patients relative to care provider are adjusting, right? So everybody's adjusting to this new experience of receiving care. And so in some areas where there was perhaps a little bit more tolerance, there's a little bit less. Expectations on the people side are actually going up a little bit. And on the technology side, the experience is growing. People are becoming more used to the experience, both on the delivery side and on the patient side. So we're seeing those scores actually improve a little bit. And one of the things, reflecting on Anita's comment with the MA population, and where you're just going to have a little bit of less familiarity with some of the technology, one of the things we've seen a lot of medical practices and health systems do around the country is really think very carefully about the workflow relative to the technology. So in Anita's example, it was sending out equipment so that people actually could connect. In other instances, it's having teams of individuals within the medical practice whose job it is to ensure virtual visit success, placing calls ahead of time, getting all of the sort of the vitals and the other critical information ahead of time so that doesn't become part of the visit itself. It sets the visit up for success, doing a trial run with the technology so that the patient feels comfortable. So really understanding that workflow, documenting what works, understanding the needs of particular patients so you can ensure success, whether it's a patient of a particular age who's less comfortable, or maybe a patient whose language preference is something other than English, and ensuring that there's a translator on the line, for example, an interpreter on the line. So those are the kinds of things that organizations are thinking about to improve that experience. And we're seeing that definitely play out in the results.
Let me add a couple more statistics to this. So, I'm going to give you some experiences from my payer customers and some more from my provider customers. So on the payer side, I went and pulled data from 5 different regional payer customers. So here is data point number 1. Jan of 2020, 100% of specialist E&M visits were done in person. So that's primary care and specialty. There were no telemedicine modifiers in the claims I pulled, right? So that's like roughly 100,000 patients. April 2020, 30% of physician visit claims had a telemedicine modifier. November of 2020, only 10% of physician visit claims had telemedicine modifiers. So went up, went back down. Very similar story to our own experience at DuPage Medical Group. We had a multi-specialty physician practice in Illinois. And we had a very similar experience in terms of volumes doubled, and now they're not zero, to be very clear, but they kind of cut in half, right? And part of it, this is my highly subjective perception, is, the workflows that Nell alluded to. Our workflow right now is streamlined for that in-person visit, right? It may not be very clear to a patient who's coming in through that door, waiting at reception, and then ultimately meeting with their doc. But their doc, when they practice medicine and when they're taking care of that patient, they're standing on the shoulders of many, many extenders and many administrative staff who work very hard, who work according to certain processes and protocols to make that visit as seamless as possible. Those are the shoulders that visit is standing on. And when you suddenly try and put technology in there, to me, it's a little bit similar to, when, I grew up in India, and I saw the transition from radio to television. So when television first came, right, people hadn't figured out that you should make content that's very different for television. They just used to take the radio content and then put a face, and that lady started announcing news. And it took them a while to figure out that you have to make content that's very, very different for a three-dimensional motion picture format, right? So similarly, I feel like technology has a long way to go, as in it needs to be reimagined in every step along the way for the administrators, for the clinical extenders, all the way to the physician, and ultimately into the patient and their own personal caregivers. That experience, the feature set, and the capabilities have to be reimagined so that it works for everybody. Because if it only works for one person, or if it's over optimized towards that person, then you'll see in a pandemic can force us all to adopt it temporarily, but you'll see the volumes dip off a little bit over time. And I think this is a challenge for all of us to reimagine that digital age and how we rethink our access to care digitally.
Thank you. As a patient experience and people-centered company, Press Ganey, you obviously want to make sure that virtual care or telehealth is expanded to populations everywhere. And you talked a little bit about this, but what are the ways specifically that the tech industry can advance virtual care as a tool for all populations, even beyond COVID?
Well, there are a lot of different virtual care platforms that are available, and they're at varying stages in terms of the features and the functionality and the reliability. Without a doubt, we are seeing these companies make big investments right now to kind of get out in front, if you will. Many of the EHR, electronic health record, medical record companies enable those capabilities in their own platforms as well. And so again, an area where a lot of investment is being made. So, and it's interesting because we are, as a nation, and probably globally safe to say as well, we have many, many technology experiences every single day. Anita began by talking about how her phone is sort of an extension of herself, and it is a way for her to seamlessly interface with a range of individuals, companies, other sort of entities that she's interfacing with. And the more seamless the experience, the better. We all come to this new reality with the sort of prominence of virtual visits, having our technology expectations shaped by all of the other technology experiences we have in our life. And interestingly, virtual visit technology is lagging behind the other technology that we're so familiar with. So a lot of investment on the part of these companies becomes really important. And the technology piece is very important. We ask patients in all of these surveys that we supply their likelihood to recommend the provider or the organization where they're receiving care. In the case of the virtual visit and telemedicine surveys, we also ask them their likelihood to recommend virtual visits as a way to receive care. So two different questions where we're asking about likelihood to recommend. And what patients have to say about likelihood to recommend their physician or advanced practitioner, what they say there with regard to their likelihood to recommend is very similar to what they say about their in-person visits. So does the provider show concern for my worries? Do they strive to include me in the decision-making? So shared decision-making, a facet of the experience, and the quality and the clarity of the communications around treatment, medication, symptoms, that sort of thing. So those three things together, if you do well on all of those three things, 99% of the time, you're going to get a likelihood to recommend. Now, for the experience of the virtual visit, one of the things that you have to do well as a provider organization is the virtual visit team has to work well together to care for you. Thinking back to something Anita said, when you step into a clinic or a medical practice, the team's right there for you. Someone is checking you in, you're sitting down with the medical assistant, your vitals are being taken, going through the problem list, what sorts of things would you like to speak with the doctor about? When you leave, you're checking out, maybe you get your labs right there. The whole team is right there, very visible to you. In virtual visits, the team's invisible, no less important. that advanced practice professional, that physician still standing on the shoulders of that entire team, but the team is not as visible unless you're putting effort in place to make that team visible. The call the day before to set up a really successful visit, to do a dry run of the technology, those sorts of things. But that saying yes to having a positive assessment of that team experience is important. Ease of talking with the provider over the video. So that's like what we're doing right now. But there's also a whole sort of intangible website manner facet there that becomes really important to delivering a good experience. And also just the video connection, which frankly is often outside the domain of influence of the provider. I mean, today I happen to have great connection with all of you because my 3 kids and my husband, who are usually trying to hog the connection, they're out of the house at the moment. I did that on purpose to make sure we would minimize the background noise. But so this video connection and the quality of that connection being something that is outside the sphere of influence of the provider, yet has an impact on whether or not the patient is going to say, yes, I'm likely to recommend virtual visits as a way to receive care. So these things in combination become very important.
Wow, you shared something very important, Nell, which made me wonder if the greatest possibility or opportunity that lies for us in the digital realm is personalization, right? Whereas in the physical world, my reception is my reception, right? My check-in process is my check-in process. Every patient that walks in the door, I will walk them through that same workflow, and I'll do it very consistently and reliably, right? The problem with averages is that they are averages and they don't represent anybody. The hope is that there is not much of a standard deviation. Whereas in the digital world, the marginal cost of personalization tends towards zero if we do this right. And I wonder if that's the single greatest opportunity in re-engineering our workflows and re-engineering the way we care using digital modalities, right? So there's a couple of statistics that I want to cite. So this is from Anthem. They said that their quarter, and I think they measured this quarter as March through May for an MA population, and they put out this report that said that apparently the MA population in that period of time compared to the same period in 2019 consumed 136 times more telehealth services. 1, because they didn't have a choice. 2, they needed the help because this is MA, they're very sick, they have chronic disease burdens that they're carrying. But how amazing is that? But I'm going to take away from that amazement by offering the next statistic, which is 98% of those visits were with a provider that they had a pre-existing relationship with. Which then, Nell, talks to your comment about there is something called website or Zoom bedside manner. So there is a new competence that one has to develop around, exuding bedside manner in the digital realm, right? And there's an opportunity to do that well and get better at it. And perhaps my last thought in reacting to Sona's question is, each one of us, and this problem is not just in telemedicine, but everywhere else in healthcare. When we make technology, we obsess with the details of what it takes to achieve, to optimize whatever it is that we're doing, except, just because we've locally optimized what we're doing, that doesn't mean the provider has globally optimized an experience, both for their workforce as well as for the patient. So a string of local optimas doesn't make a globally optimized system. And they are stuck as systems integrators, technology integrators, workflow integrators, experience integrators. And that's very hard. And I feel like all of us in technology need to own a part of that problem and support that overall process, as opposed to solely restricting ourselves to that local optimum that we set out to do.
Thank you. And so I have... Go ahead.
The other thing Anita commented on that I'd love to just double in on a little bit there is this idea of what can we do reliably, and this notion of the workflow, the essentials of effective telemedicine, those that are repeatable. How can we ensure that we are hitting those every single time? Documentation becomes very important. Measurement becomes very important, because as we're putting these processes, these practices in place, we're documenting them. We're doing things like the scripts. We're figuring out the optimal setup from a initial touch point standpoint to the flow through the visit, the conclusion of the visit. How do you recap, the necessity of recapping what we just discussed in the visit and understanding what the next steps are? All of that flow that we document very well. Once we've documented it, we put it into effect, Is it resonating with the patients? Do we see that? Are they appreciating? Are they making good comments about these things we put in place? Or are they misunderstanding? Do we need to tweak what we're doing? So this idea of what can we do reliably every single time? What elements of it can be scaled? And let's measure to see if we are accomplishing what we can accomplish. The last thing I just want to also comment on that is in reference to something Anita said is this idea of personalization. And measurement is also the key to that, right? If you are collecting all of the great data that enable you to segment and understand the experiences of different types of patients, are you collecting the race and ethnicity data? Are you capturing gender for every patient and gender preference? Are you, reliably capturing age? And you would be surprised. You would think that these things would be routinely captured, and sometimes those data are just not as clean as they need to be. So it's a basic to be able to segment by age and gender. The ability to then segment really reliably on race and ethnicity or things like language preference. These are things that are not quite so reliably done among provider organizations, but the more that they do it, the more you can really begin to understand the needs of narrowly defined types of patients, and then you can work to figure out how to meet those needs in a very reliable manner as well. Then the care feels very personalized, the connection between provider and patient is optimized, and the experience is better for everybody because the patients and the provider really want the same thing. They want an optimal experience, patient leaving feeling like the needs were met on an optimal trajectory with regard to that individual's care, and that feeling of success on the part of the care provider for having accomplished those things.
All of what both of you said is super important for the future. So I'm glad that both of you touched on that. And so I have to ask you, I've used telehealth for some of my doctor visits in college, and I've also, used it to take supervised COVID tests even. So my question is, have you used virtual care, and how has that experience been for you?
I resemble the remark I made earlier, which is I've only used it in the context of accessing, and connecting with a provider that I have a pre-existing relationship with. And for that, it's measured up, right? Because without feeling the burden of that modality, I've been able to have the conversation I want to have. I've been able to have it when I wanted to have it. And that on that particular circumstance, my kids were not hogging the Wi-Fi. So then I was actually even able to have a reliable, streaming quality, right? So it worked for me. I have not tried this with providers that I don't have a relationship with.
I also have not tried it with providers I don't have a relationship with, but I have with my children's providers with whom I have a relationship, both telephonic visits, as well as virtual visits. And it's been a really good experience. And interestingly, I've used different technology platforms for these various providers, and they generally have been good experiences. Not perfect, but maybe you have a fit or start at the beginning of a visit. Of course, in the event that we have technology issues, I just call on my in-house network administrator, which is my 16-year-old, and all of those things are taken care of right away. But generally speaking, I would say that the experiences have been positive. It's also something, reflecting back on the data and what we see among different cohorts of the population, parents of pediatric, up through 18, they tend to be really very much in favor of this because who wants to load everybody in the car and go? And these days you really don't want to because you're afraid of COVID exposure. And so to be able to get care in a virtual manner for most pediatric complaints where there isn't a lot of complexity is really a very, very much an optimal solution.
It's a good comment, Nell. When I think about what did I value the most about a telehealth visit, I think it's human, and it's in me like it's in everybody else, that we don't like delays between desire and fulfillment, right? And telehealth as a modality presents one of the best opportunities to compress that delay between need and fulfillment. The need for information, the need for advice, the need for a script refill, whatever that need is, and the ability to connect. And it's one more way to reduce the friction in there. It's a way to add liquidity to the schedules, provider schedules. And above all, it's a way to, if we get all those pieces of website manner and all the other pieces figured out, the workflow pieces figured out, I think it's a way to fundamentally rethink the doctor-patient interaction.
I definitely agree with that. I also think that there's still work to be done. And I'm reflecting, Sona, on your very first question, which we only really touched upon a little bit, which is disparities and which segments of the population are experiencing challenges with telehealth. sometimes just flat out with access to telehealth. It's not even something they've experienced, although it might be a really great way, depending on each individual and the type of care they need. It might be a really great way to connect with those facets of the population. I'm not the worry. Anita's not the worry. Our colleagues are not the worry. We have great coverage. We have relationships with providers, and we have teenagers who work out the technology issues when they surface. But certainly there are a lot of vulnerable members of our population who don't have the same kind of access and relationships that we have. And I think a lot of work needs to be undertaken there. We're seeing some good work out there, I would say. There was a great article in New England Journal of Medicine Catalyst early on during kind of the first surge, toward the end of the first surge. And it came out of UCSF, talking very specifically about wanting to understand and avoid disparities for vulnerable populations and understanding the various components. So they use data, they use measurement to understand which segments of the population were more likely to experience these disparities. So looking at it by patient attribute, building confidence in telehealth as a modality, understanding the barriers that they themselves put in place as a system that just existed because of the way they were delivering care, and figuring out how to eliminate those, really making a system-wide commitment to eliminating those became really, really important. Understanding barriers that resided with patients and how, or potential patients, and what those look like. Is it digital literacy? Is it competence? Is it language? Is it access to digital modalities, and how to solve for some of those? Where was policy a barrier? How did they engage in advocacy to make some adjustments there? Other things that might be called, kind of bucketed under that advocacy front is finding funding for local health centers so that equipment was available when people were availing themselves of those capabilities. So just a lot of really, really creative thinking, some great stuff that we see as we look around the country for identifying the gaps. What are the barriers to progress on those gaps? And let's get creative when it comes to figuring out how to address those barriers and really involve multiple key stakeholders. So I'm encouraged. There's work to be done, but I'm encouraged by the interest, the evidence of progress that we see so far, and just like that ongoing sort of commitment from a funding standpoint as well to really make sure that we move the needle here.
Thank you. I agree with both of you that the convenience of telehealth is unmatched, but there is still some work to do, but I am optimistic. And we know that telehealth as a piece of technology already existed, but COVID made it urgent. And in healthcare, we only seem to adopt things when they are urgent and important simultaneously. And, in the coming months and years when this pandemic ends, I hope we can retain this important piece of technology to meet patients where they are, when they want to be met, on the topics that they need help on, and all of that affordably and compassionately. So thank you, ladies, today for this conversation, and I look forward to continuing the dialogue.
Thank you.
Thank you very much. Thank you for engaging with us on this conversation. You represent the next generation of physician leaders. You're a pre-med student now. You will be stepping into med school in a couple of years. As you see digital as a modality, telehealth as a modality, how does it influence your thinking in terms of the medicine that you will practice, the care you will deliver? And you're also a daughter of two physicians, and you've grown up watching them practice medicine. How are you thinking about this?
It's really interesting. I feel like growing up through the years and watching, both my mother and father doing their care and, caring for patients, it's interesting to see how the technology has grown. And, personally, I think, by the time that I'm in medical school and, by the time I'm become a doctor, that's the hope. This technology is going to be so advanced, and I'm optimistic for the future that it's going to be reaching the populations that are vulnerable now, because, like I said, there is, some work to do. But I think that, with the physicians and the healthcare workers working together with patients and, other people involved in healthcare, I think that the future of telehealth and the future of medicine is bright. So.
I think you inspire me as someone who has been in healthcare for my entire career. I'm always inspired by those who are going to come and take my place. And in particular, you inspire me not only because of what you just expressed, but also I'm really impressed by your interest in understanding vulnerable populations and how to meet the needs of vulnerable populations. And I love the activism that I see in your generation. And I just wonder, on a pre-med track at Vanderbilt, do you think that, do you see yourself in good company with regard to that commitment to understanding the needs of vulnerable populations and really being as active as possible in affecting change?
Yeah, I mean, the great thing about going to Vanderbilt is that I'm surrounded by people who think the same way that I do and are interested in that activism. And luckily, I'm in a major, it's called Medicine, Health, and Society, that's interested in those perspectives on how are vulnerable populations going to get that access in the future, and how does that intersect with the healthcare that they need. And so I'm lucky to be attending Vanderbilt because I am surrounded by that. And of course, I'm in the Nashville area. Nashville's, the healthcare capital. And so there's so many opportunities around me to engage in that discussion. And I'm grateful for that.
Anita, I think we're in good hands, don't you?
I feel good. We're going to be fine, Nell.
Thank you for joining me and watching our video on equity in virtual care. I hope you leave with a new perspective on how virtual care has the potential to improve access to care for all of us if policies and practices are approached the right way. I invite you to join United States of Care to be part of the solution in creating a virtual care system that works for all of us. Please like our video, leave a comment, or email us through our website at unitedstatesofcare.org.